Hello, everyone. I need to redo part of the previous videos. There was a little technical glitch in the middle, and I was asked by a couple colleagues just to kind of hone in on this particular part of the video that talks about Dr. Ayaduria's kind of comments. So I'm going to go ahead and just redo that, where I just kind of focus on this part of the talk. So, hopefully this is kind of the bullet. This is kind of what got me going. So I kind of just wanted to talk about this anyway. So we'll kind of get started. So the kind of the bullet here is you need to be careful who you listen to. This is a real common video that's been passed around on the internet. In 2 days, it had 750,000 views. And it's an expert. And listen to his classifications. His classification, very good. He's an MIT engineer. He's running for Senate. Seems to be an expert. He presents himself very well. His name is Dr. Shiva Ayadura. And let's just listen to some of what Dr. Ayadura has to say. This is a YouTube video, again, the Daily Report with 750,000 views. So let's go ahead and get started here. So again, be careful who you listen to. Dr. Shiva Ayadura, he seems to have a good resume. Let's listen to his resume that he has.
And with that, we'll bring in a man who has multiple degrees from MIT, including a PhD in biological engineering. He is also running for Senate in 2020. Welcome, Dr. Shiva. So nice to have you on the show today.
Great to be here, Christine. I hope you're well.
So PhD from MIT. He actually does have an electrical engineering degree as well. I will, having an electrical engineering bachelor's degree myself, I will be suitably impressed that he actually has an electrical engineering degree. He is a doctor. He's a PhD doctor, so don't be confused. This is not a physician who's working in hospitals. He's a scientist or more of a researcher, but he seems to be somewhat well qualified. And let's kind of continue on here. Seems to have a good resume. He is running for Senate, so let's keep that in mind. Perhaps some political ambition there. Something to always be cognizant of what someone's motives might be when they're doing a video. He attacks Dr. Fauci, but then he makes some comments at the end of this little clip here. I have a number of clips. There's about 7 or 8 clips here that I want to go through. But he makes some comments that are quite dangerous. I don't have any problem with being attacked. I mean, you attack people. That's what makes this country great, is you don't get thrown in jail for attacking people. But when you make comments that are dangerous, such as suggesting that vaccinations are dangerous or that distancing is not a good thing for us, that's where I'm going to draw the line, because you're using your degree and your standing to suggest things that are not safe, that are against what we should be doing. So listen, he makes that comment very quick at the end of the clip. So I want you to pay attention to that part of this clip. So let's listen to the clip.
Situation. He has received both praise and criticism. What do you think? How has the president handled the outbreak?
Well, he's handled, as the best he could, given the fact that he's surrounded by sharks and people who are not really advising him well on the science side of it. What I'm talking about is Fauci, infectious disease, without any real emphasis, which is a real issue.
Okay, listen to the end here.
Fact that it is a overactive, dysfunctional, weakened immune system that overreacts, and that's what causes damage to the body. And unfortunately, Fauci is not talking about that, because the truth of that leads to a solution which has nothing to do with mandating vaccines and shutting down the country. And that's
so what he was saying there at the end. First of all, he attacks Fauci, which again is fine, but he ends again with that suggestion of against mandating vaccines and against shutting down the country. And in the middle there, he actually talks about inflammation, that this is really an inflammatory process and has nothing to do with COVID. Well, again, a near miss, which a lot of these folks do. They kind of say some things that are grounded a little bit in truth, but not telling you the whole story. The whole story is yes, it is an illness that is caused by a virus that does cause inflammation to the lung, but to suggest that it's not being caused by the virus is a flat inaccuracy. And let me say something about Dr. Fauci, and I apologize for all this writing here, but it is very important to understand who this man is. Dr. Fauci is one of the preeminent physicians of our lifetime. He is highly respected amongst multiple physicians, and to impugn him and say he is a bad person would basically be saying you would have to be saying negative things about our entire medical system to impugn this man. He is the director of the National Institute of Allergy and Infectious Diseases for the last 36 years. He has advised 6 presidents, both Republicans and Democrat. He is nonpartisan. He has helped pioneer the field of immunoregulation by making important scientific observations underpinning the current understanding of the human immune response, widely recognized for delineating the precise ways that immunosuppressive agents modulate our immune response. He developed effective therapies for certain diseases that may frequently have been fatal previously, polyarteritis, Wegener's, as well as lymphomagoid granulomatosis. That's a mouthful. He also was the architect of the president's emergency plan for AIDS relief, being credited with saving millions of lives. He contributed to the basic understanding of HIV and how it destroys the body's defenses, instrumental in the development of vaccines. He's numerous awards, including the highest civilian honor given by the president, the Presidential Medal of Freedom, National Medal of Science, 45 honorary degrees, and numerous other awards, a member of multiple medical societies, and he is the editor of Harrison's Principles of Internal Medicine, probably the preeminent book, authoritative text for medicine in this country, if not in the world. This man is highly decorated, highly intelligent, highly respected, and to attack Fauci as someone that does not know what he's talking about is flat insulting. Okay, so he goes on with some more attacks and then ends with a very interesting comment on medical education. Let's listen to this.
And why they're advising him the way that they are.
Look, if you look, Christina, at the typical MD, many of them go into wanting to become a doctor out of some noble service. But fundamentally, the medical school education is really a big pharma medical education where the doctors really train if this, then this. And the then is typically a pharmaceutical drug or some harsh medical intervention. How much governance and how much over-respect we give to MDs who unfortunately know nothing about the immune system. They don't study that in medical college or medical school.
Excellent points. Just great, excellent points. Okay, so let's just unpack what he just said. First of all, he throws out some insults saying, the typical MD, they want to become doctors out of some sense of noble service. Okay, I'm a big boy. I can deal with that. But he says medical education is really big pharma medical education. Now, when you listen to a lot of people talk, they'll start clumping things together. Like they'll say big pharma medical education, meaning just with the implication that they go together. Medical education and physicians are over here. Big pharma and pharmaceutical companies are over there. It's not big pharma medical education. Most medical schools are in large universities in all the different states of the United States. And our medical education, we are taught by educators who are paid from the state or paid from the federal government. They may have grants from the federal government. They may make money by seeing patients in an emergency department or in a clinic. They are not paid by big pharma. Big pharma may sponsor some studies, perhaps, but I would not suggest that most physicians who are teaching within the medical system are paid off by big pharma. That is just flat erroneous. Now, there is problems in our country with big pharma. No question about it. We talked about Tamiflu in one of my previous discussions. There's also a lot of questions about TPA and who exactly funded TPA. And there's a lot written and there's a lot debated about that. TPA is probably a very good drug. Perhaps it's been a little bit oversold in certain situations, maybe. And those are 2 examples of that. However, Big Pharma does have a couple very expensive drugs that are doing wonders for certain parts of the population. Humira would be a great example. Humira is a drug that costs about $80,000 a year for a single individual, but it's made a world of difference for people with specific rheumatologic type diseases. There's also a drug that's about $80,000 a year or $80,000 for a treatment, for a couple months treatment, that will cure hepatitis C. And there's no question, hepatitis C is a horrible disease that can cause liver failure and kill people. But for $80,000, our pharmaceutical industry was able to come up with a solution to that problem. And yes, our drugs are exported all over the world at a fraction of that price. So there's a side to either story with Big Pharma. However, to suggest that Big Pharma is influencing the thinking of our doctors into treating people differently is flat erroneous. Then he says, if that, this, and the then is then that, then the then is typically a pharmaceutical drug or some harsh medical intervention, indicating that if a patient has a disease, we just automatically give a drug or we do some harsh medical intervention. Let's think about that. If you've had a heart attack and you're now having a heart attack and there's a blockage in your heart somewhere and a significant amount of your heart is about to die and you go to an emergency department, what do? We do what some people might consider a harsh intervention. We go very quickly into that artery and unplug that artery by putting a needle into an artery, threading it up to the heart and pulling that clot out. If you have appendicitis, what do? We get you rushed off to the operating room, and if the harsh treatment is pulling out somebody's appendix to save their life, well, I guess that's perhaps a harsh medical intervention. But I wouldn't accurately categorize it that way. I'd categorize it more as the right thing to do. Pharmaceutical drugs, yes, we prescribe pharmaceutical drugs, and I just mentioned Humira and another expensive medicine for liver disease. But frequently, Dr. Malcolm and I will prescribe either Tylenol or Motrin for people with fever. We will prescribe inexpensive antibiotics for people that require antibiotics. In similar medicine. And if you have very expensive medicines that are on your list of medications, discuss with your doctor, is there a suitable generic to save you money? But again, this idea that everyone is corrupt and that everyone is going to prescribe expensive drugs and do harsh medical interventions, again, is erroneous. And the last thing perhaps bothers me more than anything, MDs who unfortunately know nothing about the immune system, they don't study that in medical college or medical school. Well, in the second year of medical school, I took a very painful course called Pathology and Immunology. It happened to be taught by my mother, who is a pathologist, and it involved reading a very, very thick book, Robbins and Cotran, Pathologic Basis of Disease. It was a very, very painful book. And to suggest that I did not study that in medical school, Dr. Shiva, I find very insulting. Okay, believes HIV is a hoax. Let's listen to this.
And so if you look at someone like Fauci, he's a guy who architected the big lie that HIV is responsible for AIDS. And it's a much deeper discussion, but he built his entire career on that, not talking about the fact it's the suppression of the immune system. When people's immune system gets suppressed, you can react to all sorts of exogenous things coming in.
So again, a near miss. Yes, HIV attacks the immune system, which suppresses the immune system. So he's correct that this disease is a disease that suppresses the immune system. But the fact is, the virus HIV is what does that. And Dr. Fauci is one of the preeminent people who figured out the whole pathway for how this happened. So again, a near miss, but absolutely not correct in what he is saying. Okay, so this is another one. Now listen closely to the numbers. As you're making an argument, as these folks are making an argument on TV or YouTube or on the radio, they start skewing the numbers. They start throwing these numbers out that are erroneous, that make you think, oh man, well, God, how could people be so into this or misguided with this COVID thing? Because man, those numbers, they don't sound as bad as H1N1. So listen to the numbers that he comes up with. Just listen closely here.
Said when Obama was running, you had nearly, I think, 60,000 deaths, right, with H1N1. Here you have close to maybe 10,000 deaths.
Okay, so we just heard 60,000 H1N1 deaths, and he's referring to 2009 with the swine flu, and 6,000 to 10,000 deaths with COVID in the United States. So in the United States, when he was talking about this was on April 10th. So let's do a quick fact check on these numbers that he just threw out there. It looks like H1N1 is 10 times worse than COVID. What are the facts here? Fact check. According to CDC, in 2009, we had 12,000 H1N1 deaths. And as of April 10th, at the time that he recorded this interview, we had 20,000 COVID deaths. So he's not even right about the numbers of what he's quoting. Okay, diagnosis codes. This is another very, very important point. And the point is, and I've heard it on other shows as well, I've heard it by some of our commentators on some of these shows, our hosts, is the idea that physicians are inflating COVID deaths and that they're being told to inflate COVID deaths. Let's listen to what he has to say about this.
Just had coronavirus. Dr. Birx just came out and said they're classifying everybody with the virus as a death instead of dying from the virus as a death.
IT systems, they have to say, okay, Christina has this or this. That is called a diagnosis code. That code, Christina, comes from the WHO. So for coronavirus, as I understand, they created two codes. One code was you explicitly, had a test and you had COVID-19. The other one was completely nebulous. Well, it sort of smells like that. Maybe he's got some chest pains. Something so broad, but it was still under the COVID. The doctors in the United States received a letter from the CDC, as I found out, that went to hospital administrators encouraging them to blur both of those codes. So if someone comes in, they have a pre-existing condition, someone with a chest pain, COVID-19, okay?
Okay, so I'm a doctor in the United States, and I did not receive the letter that he's referring to. And Dr. Malcolm did not receive that letter either. So again, making broad, sweeping statements about letters were sent to the doctors in the United States to do this. Now, let's just kind of talk about how exactly a COVID death is explained. Because what he's saying is, someone has chest pain, you just call it COVID. Let's talk about, again, how a death certificate reads. This is a death certificate in the United States. And there's a section, there are a bunch of demographic information up here. And down here is the cause of death. And I'm going to blow that up. And what it shows is that the immediate cause of death, this line here, A, this is the immediate cause of death up here. Then you list the subsequent or other causes or things that someone may have that lead to that cause of death. So let's go to an example of how that may look. So the cause of death, the direct cause of death for this is just an example patient, not a COVID patient, but a cerebral hemorrhage. That means a bleed in the brain. Someone has a hemorrhage or a bleeding in their brain. It is due to metastasis to the brain. So this bleed was caused because a cancer metastasized or went from somewhere up into the brain. And this was due to breast cancer. So this person had breast cancer for 5 years. And then for 4 months, it was known that they had metastasis of the brain. And then a hemorrhage happened. And within 4 hours of that hemorrhage, they died. So if this person came into the hospital, would we say that this person died of breast cancer? Or would we say they died of a cerebral hemorrhage? Well, the cause of death is going to be cerebral hemorrhage. But we are definitely going to list breast cancer as the cause of death, and cancer was what killed this person. So when you look at cancer statistics, this person would be included. So let's look at a death certificate, and this is actually from the this is from the Spanish flu in 1918, as you can see. And this is what it shows, is that contributory, this person had influenza, and they died. The cause of death, though, is bronchopneumonia. So what they had was influenza that inflamed their lungs and caused a bunch of gunking, if you will, in their lung. And then they developed pneumonia, and they died of pneumonia. So this is going to go down as a pneumonia death. But should we call this a death due to influenza? Absolutely. When we say that hundreds of thousands of people died in 1918 from influenza, this is the way their death certificate looks. So if somebody has COVID, contributory cause down here is going to be COVID, and then they may die of ARDS, which is a respiratory disease where fluid fills up in the lung. Or they might actually die of a bronchopneumonia, or they might die of sepsis or something else. But the contributory or the primary cause of what put them in the hospital was COVID. And I will guarantee you that physicians are not going to just write COVID all over every chart of every patient that passed away. That is, you'd be putting your license on the line to say that. And just physicians, I know physicians, they're flat not going to do that. They're going to put the causes down here of what they think caused that proximate cause of death up here. Okay, So he comments on social isolation, and this is another dangerous one where he's saying that social isolation, or what we are doing, is going to lead to a bunch of ill effects of people. In essence, saying we shouldn't be socially isolating right now. What we should be doing is something other than that. Very dangerous concept. Let's listen to his evidence for that.
Now, go look at the research, the landmark
Look at the
study.
research, landmark study.
Isolate people. That is one of the worse than the detriments from obesity, smoking, and heart disease. Social isolation actually leads to upregulation of inflammatory compounds in the body and down-regulation of antiviral compounds. So you're basically increasing the person for viral infection by the amount of stress you're causing them from social isolation.
Okay, so near miss on this one. Social isolation, true social isolation, does cause those problems. Let's look at the landmark study he's referring to. He's referring to the landmark study by House, Landis, and Umbersam in 1988 on social relationships and health. And what it showed was that social isolation is a risk factor for morbidity and mortality similar to hypertension, smoking, and obesity. No question. But what does the study talk about? The study is talking about people with chronic isolation, people that are isolated for years in a house. We are not talking about people who are quote, isolated in a house for a short period of time for a specific purpose. And it also talks about true social isolation, where you're cutting off social contact with other people. Low quantity and sometimes low quality of social relationships, specifically talking about older people who lack spouses or children, the people whom these older people often turn to for relatedness and support. So what they're saying is people who have no social support system, who are chronically isolated for long periods of time, exhibit these problems. We're not talking about people that have access to Facebook or who can go for a walk around the block, or people who can talk to their neighbor over the fence, or FaceTime, or all these other things. What happens is when you're socially isolated and you can't express yourself to other people, what this study is saying, that causes the problem. It's not just being kind of holed up in your house when you can still go for a walk and still communicate with other people. So again, the danger here is he's using an errant study, a study where it's not the point of the study, where he's trying to support what he's saying. But again, it's just a quick clip. It sounds great on an interview that no, we shouldn't be staying in our houses right now because of this landmark study. Again, misses the point of the study. I think this might be the last one. It's kind of interesting. Let's listen to what he says about viruses and scurvy. Remember, he's a big vitamin guy, so he likes talking about scurvy and pellagra and other kind of vitamin deficiencies. He says that it's always a virus. Everyone always says it's a virus, and they don't talk about inflammation. So let's listen to this.
Medical establishment, the pharmaceutical medical establishment for hundreds of years has built its entire foundation of always blaming a virus or a germ. Always. It came around. Remember scurvy, when people's teeth would fall out and they had bleeding gums? Oh, it must be a virus. Well, it was deficiency in vitamin C 100 years later, when even people on the ground knew it.
Okay, so he says that people said that scurvy was caused from a virus. So scurvy, in the medical establishment said, okay, it must be a virus. Okay, so what is scurvy? So scurvy is where you get, like rickets, where you get kind of brittle bones. Yeah, you have teeth problems and so on. It was actually discovered by the Egyptians 1,500 years before Christ. And documented by Hippocrates. In 1497, Vasco da Gama, one of the travelers on ships, recognized the benefits of citrus fruits. So they already knew in the 1500s that there was something about citrus fruits that prevented it. It wasn't caused by a virus, and it was very clearly stated in 1734 by Dr. Backstrom that scurvy is solely owing to a total abstinence of fresh vegetable food and greens, which alone is the primary cause of the disease. In other words, it's not caused by a virus, and we very clearly stated here, but we even knew it probably as early as 1500. So when were viruses discovered? They were discovered in the 1890s. So what he's saying is somewhere back in here, we're saying, oh, it must be a virus. Again, just kind of an interesting, another little fact check where just kind of off base. So what's the danger of this? The danger is this guy had 750,000 views. And if you read the comments just one after another is just talking about how brilliant this guy is and how we should all be listening to him. And again, this is a guy that's speaking out against vaccines, speaking out against social distancing, speaking out against Fauci, impugning him as a very bad man to listen to. So my problem with this interview is that there's a guy who's got three-quarters of a million people listening to him because he sounds good on an interview and he's saying things that people want to hear. These are the comments. Is Trump listening to this man? He should be. If Shiva's not elected to Senate, Trump should draft him as an advisor. Such a shame for so many people not to listen to common sense and reasoning. Great interview. Dr. Shiva should be the one President Trump should be listening to. Dr. Shiva is spot on. And look at all these thumbs up. This thumbs up, thumbs up, thumbs up. And this interview is being passed around the internet just people are just forwarding it on, just saying how great this guy is. And just fact check after fact check after fact check just doesn't measure up. So I'm just going to stop here. I did go to talk a little bit about the end game. But again, I want people to understand that we're doing a great job. We need to continue social distancing. We need to physical distancing. We need to stick to the game plan right now. And thanks everyone for listening. Bye.